is Brittany Deer. I'm an 8th semester nursing student, and today I'll be performing tracheostomy suction and care on a patient. I have already double checked my physician's orders for both the suctioning and the care. Walking into my patient's room, I'm gonna provide privacy, perform hand hygiene, introduce myself to the patient, double check my two patient identifiers, explain to the patient what I'm doing. I'm going to explain to them that they need to be suctioned based off their vital signs and respiratory efforts. They have agreed. I have also educated them on the fact that they may have intermittent coughing throughout the suctioning, and that's okay. It's just going to help bring up secretions. I'm already hyperoxygenating my patients, getting them ready for the suctioning, and then I also turned the suctioning on from 80 to 120, and so that's ready to go. So performing hand hygiene again, I'm going to go ahead and open up my gloves, my sterile gloves. I've already formed communication with my patient. They're going to tap my arm if they're feeling any distress towards both tasks, the suctioning and the care. Making sure in clinical setting my gloves do not roll. Stitching that. Grabbing the catheter with both hands at this point because I'm still sterile. Okay, now that I have that in my hands the way that I want it, I'm gonna go ahead and grab the suctioning tubing, making my non-dominant hand not sterile anymore. I am gonna attach that. With my non-dominant hand, I will have thumb control, which will control suction if I'm gonna suction or not. I have my normal saline out of my sterile kit. I'm gonna go ahead and flush the tubing, priming it, making sure it works, and then lubing it as well. So I'm gonna go ahead and remove my oxygen with my non-dominant hand. Before doing that, I'm gonna tell my patient to take 3 to 5 deep breaths. Okay, I'm gonna go in 5 inches, making sure my thumb is not over the control because we're not suctioning at this point. Going in 5 inches, or when my patient coughs, or when I meet resistance. Once one of those are met, I'm going to draw back 1 to 2 inches, and then I will start suctioning, twisting the tubing as I'm bringing it out. Okay, and then with my non-dominant hand, I will add the oxygen back on. And then I'm looking at my patient's vital signs. I'm also looking at their respiratory efforts, and my patient will need to be suctioned again. So I will go through the whole process again. Moving my tube, priming and making sure it works. Tell my patient to take 3 to 5 deep breaths, removing the oxygen with my non-dominant hand. I will go in 5 inches or until I meet resistance or until my patient coughs, not suctioning at this point. I'm going to withdraw 1 to 2 inches, and then I'm going to start suctioning while twisting the tube out. I'm going to add the oxygen back on, and I'm going to reassess my patient's vital signs and their respiratory efforts, and they sound clear. They verbally, or not verbally, but they have told me that they feel better, and their vital signs are stable, so the suctioning is completed. I'm going to go ahead and stitch that. And begin my tracheostomy care. In the clinical setting, this will be 2 different tasks done at 2 different times, but for the sake of the video, I'm moving from one task to the other. So for this, I would do the same thing. I would double check my physician's orders, providing privacy as I'm walking in, perform hand hygiene, double check my 2 patient identifiers, explain to the patient what I'm doing. I've already introduced myself. My patient agreed to have tracheostomy care done. I have put my patient into a working height as well. And so we're gonna go ahead and get started. I'm gonna perform hand hygiene. Okay, in the clinical setting, obviously the gloves will stay in place. So I'm gonna don on these gloves. Okay, it will go way smoother in the clinical setting. And then okay, making sure that my gloves don't roll in the clinical setting as well. I'm going to go ahead and pitch that. Opening up my tracheostomy carrier away from me, I'm going to go ahead and set up my kit. I'm going to pour half of hydrogen peroxide and normal saline in one cube, and then just normal saline in the other. Okay, and then with my non-dominant hand, I'm going to go ahead and remove my patient's inner cannula. I'm going to remove that, drop that in half hydrogen peroxide and normal saline, and then I'm going to go ahead and clean it with the brush that's provided in the sterile kit. Okay, once that's done, I'm going to drop that in the normal saline, let that sit for a little bit, and then I'm going to take it out, tap it with my dominant hand, and then I'm going to go ahead and add that back in. Making sure I hear the click for reassurance that it's in there properly. Then I'm going to go ahead and dispose of the dirty pre-cut gauze. Because in my kit I have a new one. Obviously in the clinical setting I would have another nurse at bedside to help me maintain my sterility throughout this, but for the sake of the video I don't have another set of hands, so I'll try and maintain it at the best of my ability. I'm going to go ahead and add this on. When that's on properly, I'm going to go ahead and make sure I change the necktie. Again, I would have another nurse at bedside to help me with this. As I'm taking it off, I'm going to put the new one on, working one side at a time. Once that's done, I'll make sure that's good and snug, but comfortable for the patient at the same time. Once that's established, I'll reassess my patient, get my patient back to where they were prior to me doing the task, low position, bed, everything at the bedside, and make sure everything's fine, and then I will go document relevant information. Thank you.